Okay, welcome everybody. Welcome to this pre-Thanksgiving Medicare live stream. We know you are committed to learning about Medicare if you are on a Medicare live stream the day before Thanksgiving. We want to welcome everyone. Today we are going to be talking about the number one mistake people make when they work past 65 as it relates to Medicare. So we're going to get into that. But happy Thanksgiving to everyone. If you would, while we wait, I want to give a couple minutes or a minute or so for everyone to have a chance to log in. Put in the chat where you're from, where you're tuning in from. We live in Kansas City, so we're from Kansas. But put in your state or your city or wherever. I'm always interested to know where people are from. My name is Josh Music. This is my dad, Marvin Music. Together we started this company called MedicareSchool.com, and really, it's very simple. We like to educate people about Medicare, and then we've got a team of people that we call Medicare guides that every day they come to work and really just want to walk people through Medicare. We're independent insurance brokers. We work with all the companies that fill up your mailbox, but our goal is not to sell you insurance, but it's to educate you about Medicare so that you can really get the plans that are best for your needs. Okay, I'm seeing a lot of people. California, Kansas, Oregon, Tennessee, Texas, New Mexico, New York, Alaska. Illinois, Kentucky, Alaska, Anchorage, Michigan, Little Rock, Arkansas. Love to see these, really fun. West Palm Beach, Florida. I was there a couple of days ago. Awesome. Okay, other thing I want you all to do is you can start putting questions into the chat. We're going to talk about this, the number one mistake people make when working past 65. We're going to talk about that right now. But then once we're done, we'll stay on here. I'm not sure how long yet, but maybe around an hour to talk or to answer all of your questions. So if you have any Medicare question, whatever it is, put it in the chat, and then we'll start working through those. And we'll get through absolutely as many of them as we can. So, Dad, without further ado,
all right,
number one Medicare mistake.
In my opinion, the number one Medicare mistake is when people are going to keep working. And as we address this topic, remember, it could be you working or your spouse working. So it's either. It doesn't matter. It could be both. Could be one or the other. But if we have a group plan that's available to you because you're working, the number one mistake is not starting Medicare at the right time. Some people don't start Medicare A at the right time, and some people don't start A and B at the right time. So that's what I want to address first, is making sure that you're going on Medicare at the right time, meaning you're not enrolling too early, meaning you're taking Medicare when you shouldn't be, or you're enrolling too late, you're not enrolling into Medicare when you should be. So those are the scenarios that I want to address to answer this question. But let's address first the situation when people enroll into Medicare A and B too early. And this is almost always people that are working or their spouse is working, and you have a group plan available that has 20 employees on the payroll or more. The rules with Medicare are, if there's 20 or more employees on the payroll, you don't have to do anything with Medicare whatsoever. You don't have to do A, and you don't have to do Medicare B. Certainly don't have to do both. So that's the cutoff. 20 or more, you don't have to do anything with Medicare. And in addition to that, I think it's a mistake for people enrolled in Medicare if there's 20 or more on the group plan, and secondly, if you have a good group plan, or it could be a great group plan. And the way we define that is it's a plan that has a lower deductible, it has a very affordable premium, typically $200 a month or less per person, and you like the coverage of that plan. So it's a good group plan. Another issue with this is if there's other family members that are on that group plan, because if you were to go on Medicare and come off the group plan, then they're more than likely going to lose their coverage as well. So the point is, if the group is 20 or more employees on that payroll, you don't have to do anything at all with Medicare. And if you have a good group plan, you most certainly should not. Continue to stay on that, and it is fine. Now, I would encourage people, when you're Medicare eligible and you're not sure if the group plan would be considered to be good or not, you can always do a comparison. And we have people regularly that ask us to help them with this decision, and we will do so. And I promise you, we're going to be honest with you about, in fact, just this morning, just so you know, we have a lot of guides, but we still are family owned and operated. And this morning, Joshua's brother Josiah came to me with the situation. A lady had a union plan actually available. And so I said, after he told me the scenario, I said, tell her to stay on that plan. It was a good plan. Husband's still working. And so we will be honest with you as we help you compare. So here's how you compare. The number one question, what's it going to cost you to be on the group plan as far as the premium? What's the cost? We're going to look at the deductible. Is it a high deductible, low deductible? Do you ever meet the deductible? What's the max out of pocket? Is that ever an issue? So again, if you have a low deductible, a low premium, then you stay on the group plan. If you have a spouse or somebody else, the kids on the plan, then again, you may want to stay on there for them as well if they don't have other insurance options. So don't enroll into Medicare A and B if you have a group plan available, good coverage and good cost, but do take the time to do a comparison. We'd be happy to do that. Now, I want to clarify one thing about this because I do see this regularly. We'll have people that husband and wife are both eligible for Medicare. And what we want to know as we compare is what is the employee-only price for the group plan and then employee plus spouse price. I had this recently out of St. Louis, had a lady that both were eligible for Medicare. She was working, he was already retired on her group plan. Employee-only price for her was $100 a month. Adds him to the plan, it's $500 a month. So now it's costing her $400 a month to cover him. That's not very attractive. And the plan was still good, but $400 a month. So we encourage them for her to stay on the group plan. He goes on Medicare. That's what they did. And it was just made a lot of financial sense. Now, I do want to share one more thing about this. Those of you that hear me saying about not having to take Medicare A and B, know that when you do lose the group plan, either voluntarily or involuntarily, you can pick up Medicare during what's called the special enrollment period. And this is for people that didn't start Medicare at 65. You can pick it up later through the SEP, special enrollment period. And all we have to do is verify that you've had credible coverage of insurance at work back to 65. So don't panic thinking you have to enroll at 65. You can do it at a later date as long as we prove you've had credible coverage on a group plan back to 65. All right, and so that's the rule. So I want you to know that. Now, here's the unique issue we find with a lot of people, and that's this. If you So again, even though you're automatically enrolled in A and B, if you have a group plan 20 or more that's attractive to you, you don't have to keep A and B. You can actually delay B, and you do that by sending the card back in, or we fill out a form called the 1763, and you can drop off B, and then you can pick up B at a later date. So rest assured, you're not going to be put in a bad position. Okay? Now, I want to also talk about enrolling into Medicare A only too early. We see this often. Okay, so this is someone that says, hey, I realize I don't have to take B, but I've been told that if I keep working or my spouse is working still, I have to take A only. And that is not true. You don't have to have A only. And the reason it matters is because some of you, if you enroll into A only, if you are contributing to your HSA, that's called a health savings account, you can no longer make any new contributions to the HSA. And so, in my opinion, you've really hurt yourself. And so you don't have to take A only. Now, you'll hear people say you have to take A only or you'll be penalized. And that is not true. In fact, as long as Medicare A only is zero premium, which is the fact for 99% of the population, you will never pay a premium for A, and therefore you'll never be penalized for A. So don't enroll because you've been told you'll have a penalty. Because if you have an HSA, no new money goes in. And I think HSAs are wonderful. And so I would much rather have, just my HSA than an A only, because the HSA right now, the new contributions for 2024 are $4,150 into the HSA, plus $1,000 if you're above 55. They call that a catch-up. So you can put in over $5,000 a year into an HSA. It goes in tax deferred, it's tax deductible, tax exempt if you use it for medical expenses. And so I like HSA plans. So I would encourage you, don't enroll in A only if you have an HSA. Now, if you don't have an HSA, that's fine. Enroll into A only. In fact, I recommend it. And the reason for you're you're in the system, and A may pay something, but keep this in mind. If the group is 20 or more, Medicare pays second, and your group plan pays first. And Medicare A only in the second payer position will not pay deductibles, will not pay co-pays, but it will pay co-insurance. So that could happen for someone. All right. So those are the scenarios that I think you need to be aware of as to enrolling into Medicare A or B or A only too early. So don't do that. Now, there's a second group of people, and that's people who enroll into A and B too late, meaning you should have taken Medicare at 65. And this would be anyone that is still working or your spouse is still working and there's 20 employees on the payroll or less. You have to enroll into Medicare at 65. So your 65th birth month, you need to be enrolled into Medicare. And the reason for that is because when the group is 20 or less, Medicare A and B pays first and your group plan pays second. And so if you don't enroll into A and B and you have some kind of a large claim, I can assure you that group plan insurance company is going to say, hey, we're sorry you didn't enroll in A and B, but we're still in the second payer position and you will have to pay first. So that is 20 employees or less. Now, what we find is that most people that are in small group plans, they have to enroll in A and B, and they could keep the group plan, or they could get a supplemental plan or an advantage plan. And what we find is that most people go ahead and come out of the group plan completely because it makes more sense for them as well as probably for the employer. And we'll even see employers oftentimes give them a pay raise, to kind of cover their insurance. So again, you have to start Medicare at 65. Now, what I would also say, there's some of you that have these group plans that are terrible. I would just call them a mediocre plan. So again, you may want to start Medicare at 65. So that's a group that should start. So in fact, I had a car salesman just recently. He was on a group plan, over 20 people, and the premium was $600 a month just for him. Lousy. Yeah. And of course, we encourage him to get off that, and he did. It just doesn't make financial sense. So even if your group is 20 or more, if it's a mediocre plan, high deductible, high premiums, then go ahead and go on Medicare, and your company has to let you do that. All right, so those are the scenarios. Starting too early or starting too late. We don't want that to happen to you. All right.
Okay, so we're going to move into some question and answer. Real quick, before I do that, I just want to let you know, for those who are just now tuning in, MedicareSchool.com does two things. We like to educate people about Medicare, and then we've got a team of people that will help you one-on-one walk through your particular scenario and help you make sure you're on the right coverage for the coming year. We have just a great group of people out that are out on the floor that are really just wanting to help. We're licensed in all 50 states, so it doesn't matter where you live. We would love the opportunity to assist you, do coverage reviews. If you need a supplemental plan, if you need an advantage plan, if you're just not happy with your coverage, or maybe you're just beginning Medicare for the first time and you need somebody to help you make sure all the government forms are filled out right, all the enrollments are done. We really help everyone with Medicare A to Z. And our services are free. We do not work for free, but we are free to you. So as with all insurance products, if you purchase something, we are paid by that insurance company. And what we've done for all the people who work for us is we've standardized any of their compensation. So they do not make more money if they sell you an advantage plan, or they do not make more money if you buy a supplement plan. It doesn't matter to them. We wanted to take all of the bias out of their advice so that really they are able to just sit on your side of the table and help you determine, okay, what makes most sense for you. So I'm going to put our phone number up here on the screen. If you want us to assist you during this annual election period, or maybe you're turning 65 2 years from now, write our phone number down. This is our direct line. There's also the 800 number scrolling down along the bottom that we'll keep down there, and we would love to assist you. Okay, without further ado, let's hop into some of your guys' questions. So first question, do you have a number to call outside of these general live chats? I usually have questions, but don't know who or where to ask. Yes, the phone number is scrolling along the bottom of the screen. Call us there, and we will be happy to assist you. Okay, let me scroll down here. So somebody asked a question about food. How do we get some of these food things? So let's discuss that, because you're going to see some TV commercials, maybe some billboards talking about flex cards or grocery cards or things like that.
Exactly right. Yeah, well, the majority of the plans that have food, and again, there's there's 7,000 or 8,000 plans this year, so I can't speak for every single plan. But as a general rule, the plans that offer the food allowance are for people that are also eligible for Medicaid. And that's what's called the Medicare Savings Program that your state participates in, called Medicaid. And so between Medicare and Medicaid, there are these plans then that will allow you to take some of the benefits that they offer to you and actually use those for food items. It has to be healthy food items. I don't think it's just anything you want to get. But again, keep in mind that's typically Medicare, Medicaid. And so this would be someone that qualifies for Medicaid because of their income and their assets. You have to have fairly low income and fairly low assets or resources to qualify for that.
Yeah,
as a general rule, most people are going to get that.
Usually on those advertisements, they say, you're going to get all this stuff, and then it says you have to qualify for Medicaid as well. That's pretty common, but it makes for a great TV advertisement, or makes for a great billboard, so that you call in and then you get on the line with the salesperson, and that salesperson says, well, I'm sorry you don't qualify for that, but let's see what else you can do. And they try to sell you a different plan. So be careful of those sorts of advertisements.
Yeah, it's a lot of bait and switch.
Okay, Ada Maria Rosenberg, I'm 68 and retiring end of year. What can I do now?
Okay. Well, if your employment is going to end 12/31, and that means your insurance is probably going to end at the same time, so you're going to want to start your Medicare January 1, 2024. So it's time to get serious, not time to panic, but it is time to get moving. And what's going to happen is, if you work with us, and by the way, we'll walk you through this whole process, but there's two forms that are required to come into Medicare at 68. One is called an L564. And Ada Maria, if you've only had one employer since 65, then you only have to have one L564 form. And again, we would fill this out for you. You would take it to your employer. An employer is going to verify you've been employed and you have insurance. And so that's the L564. That proves that you've had credible coverage, and it proves that you can come into Medicare using the SEP, no penalties and no problems. And then the second form that we would do for you is called a 40B. And again, this is a very simple form. And on this form, your name, your social security number, you sign the form, and then the comment section, we would put in there, please begin my Medicare Part B effective 1/1/2024. Now, Ada Maria, if you haven't enrolled in A yet, then we would go ahead and do an online application for A only, because we never submit the L564 and the 40B unless you have A only, because they won't process a B only application. And so the 40B will specify when you want to start. The L564 tells us that you're eligible, and those are then going to be submitted to your local a Social Security office by fax, by mail. Drop them off if you'd like to do that. And it's a very simple process, and we'd be delighted to walk you through that process. Okay?
Okay, this is a kind of a Social Security question. How much can you earn after 65?
Okay. Let's do it this way. Anyone that is going to continue to work from the age of 62 until the year you hit your full retirement age, that year. This next year in 2024, that number is $22,320 in wages. So when you say earn, it's wages. You can earn as much money as you want in investments, distributions, IRAs, 401ks, rental income. All that income doesn't count. Only working wages counts towards the earnings test. And so it's very low, $22,320. And so for every $2 we make above that, they're going to reduce your Social Security benefit by $1. That's the penalty. So if you're above $4,000, they're going to withhold $2,000 of your Social Security checks, and then they'll turn the checks on. Now, the year that we turn full retirement age, and again, I don't know when yours is. Yours is probably, you're going to probably turn like 66 in 10 months. But the year we turn, they raise that up a lot. And next year, it is $59,520. So the year we turn, we can make much more. Penalty is less. For every $3 above, they take $1 out. And then once we hit the month of our full retirement age, then it's unlimited. There is no longer an earnings test, folks, once we hit that month that we turn full retirement age. So we have two numbers, a low number, then we have the higher number, and then it goes away totally at full retirement age.
Perfect. Okay. Does TRICARE have Part D embedded in it?
Well, It's not called Part D. It does have prescription drug coverage embedded. That's true, and it is creditable. And so you would not have to have a Part D plan if you have TRICARE because of that embedded prescription drug plan.
Okay, how do I know if my supplement includes dental, vision, hearing?
Okay.
Probably doesn't.
Yeah, most of them do not. There is one carrier that will have some like discounts for dental, vision,
Yeah.
hearing plans, but the majority of them do not. And that's what you got to remember when you get a supplemental plan. Supplemental plans are wonderful insurance. I would call it Cadillac insurance, but they don't come with a lot of perks. So you'd have to typically buy your own dental plan. Let me address this. In my opinion, vision plans are cheap if you want one, but you got to remember, if you stay in original Medicare and get a supplemental plan, you have great vision benefits because Medicare covers glaucoma, cataracts, wet macular degeneration or dry. Any kind of vision problems you have are covered by Medicare. And so if you do get a vision plan, they're cheap, usually $10 to about $15 a month. What they're going to do is give you one routine eye exam a year, and they're going to give you some credit or good discounts on eyewear. Because those are the only two things Medicare does not cover when it comes to vision. Preventive eye exams and eyewear. But Medicare covers everything else, medically necessary eye exams and all the diseases, of course, as well. Medicare does not cover hearing. There are some plans out there you can get for some hearing benefit. Typically, those are going to be perks offered by Advantage plans.
Yeah, so generally your supplements, your F plan, G plan, N plan, they're not going to have those benefits included. And if you have an Advantage plan, oftentimes those benefits are included.
Right. And there's a lot of good hearing aids today over the counter.
Yeah.
So.
And there's good standalone dental plans. If you call us, we'll help you find a dental, vision, whatever you need. Okay, Larry Johnson, if I switch prescription plans, will the insurance company I switch to notify my current insurance provider about the switch, or do I have to? And the answer to that is no, you don't have to do anything. The way the system is set up is if you submit a new application for a prescription drug plan sometime during October 15th to December the 7th, that plan will automatically kick out the old plan at the very end of the year, and your new plan will take effect. So you don't have to worry about calling up the old insurance company and saying cancel the plan. It all happens automatically, seamlessly. Make it very easy for you. Okay, does an HMO plan cover emergency surgery and hospital stay when out of network?
Okay. Well, yes, and here's the way that works. HMO plans are going to cover emergency or urgent care. There's no network in those situations. So if you had an emergency situation where you had to have surgery as well, that HMO would cover you as though you are in network for that situation. Now, I have heard of times when someone was on an HMO and they were out of network, and the emergency stay was covered, and what happened is that insurance company wanted the person to kind of just get stable in that situation. They wanted them to get to a network hospital. Very, very bizarre. But if it was life or death, yes, it's going to be covered at an in-network cost. But they're going to look at that situation for sure.
Okay, Susan Chauffeur, I have A and B applied for supplement. Oh, this is more of a customer service question. Okay, Susan, will you call our 800 number and ask to speak to somebody on our client support team, and they will be able to assist you. 800-864-8890, call them, and they'll be able to tell you the specifics on your plan. Okay, should a husband and wife be on different Medicare Advantage plans?
Yeah, it doesn't matter. It doesn't benefit you if you are, and doesn't hurt you if you're not. I wouldn't make that a criteria for me, because what you're looking at is your doctors. Are they in the network? That could vary. Your medications. You may have one plan that's available in your market that has a better embedded prescription drug plan. So don't worry about being on the same one. If you are, it's fine, but don't make that a priority. Make your coverage the priority. Are your docs covered, hospitals covered, and medications covered at the best price? Then you select your plan.
Stephen, is there an 800 customer service Part A RX's supplement? Not exactly sure what you mean there, but if you need help choosing a drug plan, a supplement plan, that sort of stuff, give us a call. That 800 number scrolling along the bottom of the screen. We would be honored and delighted to help you.
Yeah, and we do have a customer service team that's in-house. A lot of these insurance companies today are farming out their customer service international call centers. We do not do that. you can call right here and you'll understand us, and we understand your problems, and we'll help you.
Okay, Brian, I'm 71 years and I'm covered by an employer group retiree plan using SL credits to pay the premium. When the credits run out next year, would I be subject to medical underwriting if I switch to a plan G?
Okay, so 71, that means you were born in, what would that be, 71?
Well, it'd be an F plan.
It would be an F
yeah,
plan
well,
for sure.
6 years ago, he
Okay.
became eligible, so that's
Okay.
more.
Okay,
Yeah.
that sounds
Yeah.
good. Okay, yes. So what's going to happen is you're eligible, Brian, only for guaranteed issue F plan. And I don't know for sure where you live, but in the majority of states, the guaranteed issue plan for you, because your birthday, you were born before January 1st, 1955, you could get a guaranteed issue F, which is going to be a high premium. So if you wanted a G plan in that scenario, you're going to have to go through underwriting to do that. And we're happy to discuss what those options are. So you don't have to be perfectly healthy to get through underwriting.
He lives in Wisconsin.
Wisconsin.
Yeah.
Okay. Yeah.
Which isn't even.
Yeah. Wisconsin is also unique. However, I don't think they have the different open enrollment type rules. So yeah,
Okay.
I believe it. By the way, hey Brian, they may not call it your plan a G plan. They have an equivalent G plan in Wisconsin, and the same rule would apply. You would not qualify for that without underwriting. You'd qualify for that equivalent F plan.
Okay. Did you get the notice that Medicare terminated Clear Spring Premier Part D plan due to star rating 1 and 2 over the last 3 years? Do you take low star ratings? Yeah, so Clear Spring fell off because they're not offering anything new for next year. So off any tool, it would have fallen off automatically because they're not available.
Yeah.
As far as taking
good.
low star ratings, many of the low star rating plans we do not have on our, we do not recommend. However, there are some limited instances, like it just makes sense because maybe they have a specific medication with a great copay for people. So every once in a while, we will have to recommend a lower star rating plan. But generally speaking, if it's 3, 3.5, 4, somewhere in that range is where most of them seem to fall. There's very few 4.5s, very few, if any, 5s. I don't know if there's any 5s.
Right. Well, I'm going to give you my opinion about this. I am disappointed when I see a star rating of 1.5 or 2, for sure. However, when I'm looking at the annual cost and doing a comparison, let's say I have an annual cost on that 1 or 1.5, 2-star plan. Let's say it's $1,300 a year total, and my next plan is $2,500 or more. I would go ahead and take the risk of enrolling into a low star plan if there's going to be that drastic of a difference in annual cost. That's me. Now, if there's $100 or something or less, wouldn't take the chance on it.
Yeah.
But if it's substantial, because I've done that this year with some people for sure. So I'd enroll in that star plan anyways, even if it's low, if it makes a big difference financially.
Okay, I'm planning to stay on my employer's plan. What is the process to get on Medicare when I officially retire?
Okay, yeah, that's what we just talked about. That is called the SEP, and the special enrollment period is for anyone that is 65 years and 4 months on. So I don't know sure when you're going to retire, but the only way to come into Medicare is through the SEP process, which requires an L564 form to verify you've been working and covered by a group plan of you or your spouses back to 65, and then the 40B form tells Medicare when you want to start your Medicare. And just remember, this is real important. Do not submit all that paperwork or have it dated any sooner than 90 days of your start date. You don't submit that 4, 5, 6 months in advance, they will not process it. We want nothing dated any older than 90 days. So if I'm going to start January 1, this is the time to do it. If I'm going to start July 1, this is not the time to do that. They just won't process those.
Okay, Joe Cameron, will Plan G be available in the long term?
Well, we don't know for sure, but we think so. The only reason that Medicare didn't like the F plan is because there was no participation beyond premium. Yeah. That's why they eliminated that plan. They wanted people to have some skin in the game in the form of a deductible or copays, and so I don't think it's going away at all.
Okay.
Not our lifetime, my lifetime. Maybe your lifetime.
Medicare would probably be gone. Okay, are 2 premiums taken out for Medicare and supplement monthly? Okay. Yes. So your Medicare Part B premium will come out separately than your supplement plan.
Yeah. But if you're on Social Security, your Part B premiums come out of your Social Security check. Your supplemental plan is not coming out of your Social Security check. It has to be paid through a bank draft. So when you say taking out, it is true. They are taken out, but different accounts. Now, if you're not on Social Security, then you can set up some kind of a bank draft for your Medicare Part B premiums or pay a direct quarterly bill.
Is there a Medicare plan that covers dental implants?
No, there's not. Now, you could have a carrier that will include, will make available some kind of a dental plan that can have that. But
Yeah.
Medicare by itself is not going to.
Yeah,
there are some
she probably
carriers.
means just
So,
Yeah, you can definitely get dental plans that cover dental implants.
Yeah, okay, I understand.
Yeah.
So, but those are still standalone dental plans, separate dental plans. There's nothing that Medicare is participating in at all. That's what threw me off. Sorry. So yeah, Josh is right. There's standalone dental plans that cover implants. Now you want to read the fine print. Most of the ones that we write do. You can even use them for dentures, implants, root canals, all that. And if you have that situation coming up, you want a plan that's going to be, cover you at least $3,000 to $5,000 on an annual basis. And they're out there.
Yeah.
Yeah.
Yeah,
And the
give us a
key to
call.
you, Kim, if you're on a group plan and getting ready to retire, be sure you have no longer of a gap than 30 days moving off the group plan at work to a standalone dental plan, because then you don't have waiting periods.
Right.
Yeah.
Okay, I'm still employed past 65, but enrolled in Part A and covered under my employer group plan. Should I disenroll from Part A until I quit working and no longer covered?
Okay, and Dave, you can't. Once someone has enrolled in Medicare Part A, you cannot disenroll from A if A has already gone effective, unless you're paying for Part A, and that's only 1% of the population. And so when you look at that Form 1763, when we're disenrolling from A, it says premium Part A or premium for Part B. So if you have A, you're going to have to keep it. And again, you just cannot disenroll. But now listen, let's say someone enrolled in A only today and it's going to go effective, January or February, then they could disenroll it before A went effective. And keep in mind also, Dave, if you're on Social Security, you couldn't disenroll from A anyways.
Yeah.
Okay? You have to be enrolled in A if you're receiving Social Security benefits.
And if you have A, you can't contribute to an HSA.
That's right.
Yep. Okay, I signed up for Part A. Will be retiring in July 24. When should I sign up for traditional Medicare and Parts D and G? I'm not interested in the Advantage plan. 90 days before.
That's right. That's right. So let's do it. So if you're retiring in July, if your coverage is going to cover you, usually group plans cover you month of. So as I read that, you're probably going to start August. So just back up the clock 3 months. So August, July, June, May. So right around April, May, you're ready to go. And that's the perfect time to do it. In fact, people ask me all the time, when do we call you? 60 to 90 days before you're going to get off that group plan or turn 65. That's when it's time to get serious about enrolling. And you can do it before that. If you're turning 65, we actually can do that 6 months in advance.
Yeah.
But for your situation, Ed, it's that 90-day window prior to losing the group plan.
Yeah. Give us a call. Our phone number's down at the bottom. We'll walk you through the supplement plan options, help you choose a drug plan with the lowest annual out-of-pocket costs, help you enroll in Part B, make sure all the paperwork's done in the right way so that it's a smooth transition. There really shouldn't be any penalties. There shouldn't be any gaps in coverage if you do it the right way. Yeah. Okay, let me keep going. We just answered this. Can you remove Part A if enrolled? The answer to that is no, right?
If it's already gone to effect and it's free, you cannot.
Okay, D. Sylvester, a lot of negative press about healthcare systems not accepting Advantage plans. What's the truth?
Yeah, it is true. There are some that are having difficulties with the Advantage companies. And you got to remember, Advantage companies are in it for the money. It's just a fact, and they want to get their profit margin. And so if there are providers, hospitals, and doctors that will not see patients and take care of patients at that a dollar amount that the Advantage plan wants to pay, then those providers are going to pull out of that network, and that really is the issue. They don't like the amount that they get. They just cannot treat patients. In fact, we see this a lot with skilled nursing facilities, and I'm telling you, folks, this is a big deal. You can be hard pressed to find a skilled nursing facility. I'm not saying it's impossible, but there are a lot of them that are not going to take Advantage plans because they don't get enough money. I wrote a plan for a guy a few months ago, sometime back. Anyways, he said he was in that business. He said they lose money for reimbursements for skilled nursing stays. Also, the Advantage plans want to move people out of skilled nursing stage real quickly, and so that's frustrating to them. So that's why you have docs and other groups that are just pulling out of these networks. It happens.
Hello, I'm new. Are you father and son? Yes, we're father and son.
We are.
Not everyone that works at the company, though, is family.
No. We have one other son I have here and a son-in-law. So there's 4 family members here, and your mother-in-law. So we have a few. We have about 90 employees in our company. So handful of us are family.
Okay, is the cost comparison Part A and B versus employer plan a standard part of the decision process, or do I need to ask my guy to do it? Thanks. Yeah, if you're talking with one of our agents, they'll walk you through that. They know very easily how to compare your employer coverage to Medicare, and we will tell you the truth, too. There's no sense in lying. At the end of the day, we want you to become our client at some point. It doesn't have to be right now. And so whatever is best for you is what we will recommend every single time.
Hey, can I make a comment here about this? Mm-hmm. It's important also to note that if you are still working, your employer has to let you go at 65. They cannot resist that. You have a life-changing event, you're eligible for Medicare, you can come off the group plan. After that, though, what happens? Let's say you want to come in at 66 or 67 because you're going to keep working, but the group plan is no longer a good group plan. Most employers will still let you go at any time, but they do have the right to say no. You can only go on to Medicare now during the company's open enrollment season. We have a few employers here in the city that do that, so just be aware of that. Yes, always at 65, but beyond that, there are some specific rules. They have to let you go at your open enrollment season or any time if they will allow that. So keep it in mind. You got to ask your HR department about that.
Okay. I'm 65, still working. I have insurance through my employer. Should I go ahead and get Part A?
As long as you do not have an HSA now or don't think you will have an HSA, then it's fine to enroll in A. In fact, I encourage it as long as you don't have an HSA.
Okay. Do you assist with any Medicare claims and billing issues if we sign up with you?
Yes, we do. We have a customer service team that would address any kind of a problem that you have. Now, I will tell you this, in this Medicare claim billing issue, more than likely we're going to probably have to do a 3-way call either with the hospital or doc or Medicare, but we get involved with those things with our clients.
Okay. Okay, this is a good one. Use your advice after I asked for a no copay plan. I took United Healthcare Supplement plus Aetna Silver Script for pharmacy. The latter doesn't cover the eye drops I need, so you must have got a new medication since we signed you up. Thinking about switching. So what you can do here, Larry, is go to, I'm putting a thing up on here. Go to this, changemypdp.com. And when you go there, you're going to see a video from Marvin. He's going to walk you through how to change your drug plan. There's going to be a link to be able to go in, and you should have a username and password. If you don't, contact us. We can email it to you. And then you'll go in, make sure all of your medications are up to date. If you've had any changes over the last year, click next a couple times, and it literally will say, this is the plan you need to be on. If that's not the plan that you're on currently, you can click enroll. And about 3 minutes later, you'll be enrolled in that plan. It makes it really easy. So go to changemypdp.com to walk through that process.
Yeah, and the majority of eye drops are covered by some plan, but there could be some that just don't cover. I had a medication I looked at yesterday. There was no plan that covered this lady's medication. Why? Because there's other alternatives to that medication that are more low cost, and that's the sad thing. You're just bound to that.
Okay, I'm guessing when you stated HSA, it is different than FSA. Can you still contribute to FSA?
That's right. Yeah, flexible spending account is the FSA, and yeah, you can. Remember, that's the one. There's no IRS rules with that, other than it comes off pre-tax. But if you don't use it, you lose it. HSAs accumulate, and that's the difference. So flexible spending, keep contributing, no problem. Health reimbursement arrangements, keep contributing, again, no problem. So only HSAs.
I'm 68, finally quitting my job January 1st, and I will be filing for Social Security. If I file in December, will I get the January higher rate? I only have Medicare Part A. Thanks. Probably talking about Part B.
Okay.
So there is like a misconception. Maybe I'm reading the question wrong. There's a misconception that like when you sign up for Medicare, if you were to do it like this year versus next year, you'll be locked in at the lower Part B premium. That's not how it works. Everyone pays the same. Like if there's an increase, which there is an increase in Medicare Part B for next year, everyone's going to pay that. It doesn't matter if you start it in December or start it in January. If that's not the answer to your question, Vicki or Dave, give us a little more context.
But also, I think the other thing to say, Vicki, if you file in December, what's going to happen is you're going to specify when you want to start. And so if you're going to start in January, Josh is right. You're going to get that higher rate. Everyone does. So
but if you were to start in December, you would have 1 month of the lower rate, and the very next month it would bump up to the next rate.
Right. Yeah. And then I guess you're not talking about Social Security income, so we'll leave it at that.
Okay, Patrick Jankowski. My wife is a cancer survivor and is currently covered under my plan. I'm still working. Can she keep her current doctors when we both go to Medicare?
Yeah. More than likely. The majority of doctors do take Medicare. Now, they may not take Advantage plans if you decide to go that direction, but we find 99% of all doctors take original Medicare. So if you enroll in A and B, get a supplemental plan, she should be able to keep her docs.
Okay.
And Patrick, just ask them if they take original Medicare. And then if they say yes to that, then when you get a supplemental plan, you don't have to worry about it. Because any doc that takes original Medicare has to take your supplemental plan. Any hospital, same way.
Okay, I'm trying to find a good question here. Okay, what is Medicare Advantage? I understood they don't cover hospital expenses like Medicare. I thought of it more as being a disadvantage. Okay.
Well, Medicare Advantage plan, Barb, is a replacement plan. We only have two options when we go on Medicare. We take A and B and get a supplemental plan to fill in the gaps, or we get a C plan, which is the Advantage plan, which replaces original Medicare A and B. And what they do, the way they work, is they put together a network of providers that you should go to, and then you have a schedule of copays. And just so you know, they do cover hospital expenses. What you would have to do on most Advantage plans is you would be responsible for a daily copay in the hospital. Average is about $350 a day. There's some higher, some lower, but about $350 a day. So let's say you go to the hospital and you have a plan that has a $350 a day copay, and let's say it's 6 days. You'd be responsible for those 6 days at $350, and then if you're in the hospital the 7th day on, then there'd be no cost to you. And then if you go in the hospital, 3 months later, same thing happens again. So it's a daily copay. If you say an original Medicare A and B and get a supplemental plan, going to the hospital would be zero because your supplemental plan is going to cover any out-of-pocket expenses to the hospital, not doctors. You have a small deductible there, but. Yeah.
Okay. Is it too late to apply for Plan G? Give us some more context.
Yeah.
Hopefully not.
Yeah.
We just need to know a little bit more about what you mean. I'm a veteran and I'm priority group 1 where there's no medical cost for me or for medical or prescriptions. Do I need to sign up for Medicare and Medicare Advantage, Medigap plan, and Part D plan?
Okay, very good. Tony, you are not obligated to take anything other than Medicare A. Because the VA is not going to bill Medicare. Medicare is not going to pay the VA. They're both government entities, so there's not going to be no coordination of benefits there. So in your position, you could get by with A only, for sure. Now, if you decide later that you wish you had B, and I've seen this happen a lot, people disappointed with the VA system or whatever, and they'd like to be able to go outside of VA, and then you pick up B at a later date, now you're going to be penalized. Because for every 12 months we go without Medicare B, we have a 10% penalty, and it's a lifetime penalty. So if you go without 3 years, you got a 30% penalty, and you'll pay it for life, and so that would be the issue. So we encourage veterans, as long as you can afford the premium, to go ahead and enroll in A and B. And then if you do have A and B, then what I would recommend is not getting a supplemental plan because you like the VA, you're in that system, and everything is no cost. So what we'll have a lot of veterans do in your situation is have A and B and then get a Medicare Advantage plan only. And the reason for that is because now you do have a good civilian option beyond just the VA. And we do MA only because you're going to get your prescriptions through the VA. And then what the Advantage plan does is they're going to give you some kind of a credit back towards your Medicare Part B premium because they're not responsible for your meds. And most of those right now are what, $50 to $100 a month. So that really pulls that Part B premium down. So I would suggest enrolling in A and B and getting an MA only plan to help offset some of those B premiums.
Okay, that's a good question. As it stands now, I wouldn't meet the Part B to Part D deductible. Should I just get the cheapest Part D available? So I think it's important to, I mean, that's one way to go about it. It's important to know that those deductibles generally only apply to brand name medications, so tier 3 and above. So on your tiers, there's generally preferred generics, which is tier 1. These are the cheapest. And there's generics, not preferred, but they're still generics, so they're pretty inexpensive. And then you get into preferred brands, and then specialties. So those are the 5 tiers. So if you're in a situation, probably, it sounds like you're maybe on just a couple of cheap generic meds, don't really worry about that deductible. I would use a tool like changemypdp.com, use some sort of a tool or contact us. We can help you to find the right drug plan, not necessarily just the cheapest. Because you could take a cheap drug plan that has more expensive copays or a different tiering for your medication. So don't just get the cheapest and run into it blindly. The deductible is not the whole story, is I guess what I'm trying to say. Okay, thank you for great information. Thank you, Alice. We appreciate it. If someone is already on Plan G and wants to switch to Plan N, is medical underwriting mandatory? And the answer to that is yes.
Almost always yes. That's right.
Except in a few states.
That's right.
Yeah.
Some birthday rule states, you can move G to G, G to N, no underwriting around your birthday. Those are birthday rule states. There's not very many of them. There's about 10 of them. But as a general rule, Josh is right. You're going to have to go through underwriting to make that switch. Yep.
This is interesting. Okay, if I'm employed, have adequate employer insurance, have reached full retirement age, and then start taking Social Security, I understand I'm automatically enrolled in Medicare Part A. Is this true?
That's true. It is true. Yeah, once you've started Social Security, you will have an A date. And, yep, you're right.
Okay. We'll try this one. If you have state insurance in Alabama, small town of 7 employees, work for the mayor, are we grouped with the whole state of Alabama or just our town for the number of employees on payroll?
That's interesting. You have state insurance. I would say that you are not considered small. You would be considered, because your group plan would be for all the employees of the state that are on that plan. So I would not call that a small employer if it's state insurance.
Okay, Sharon, I just turned 70 and still work full-time. Benefits are fantastic. I have Part A. Is there anything else I need to do? No idea when I'll retire, but when I want to be prepared when I do.
Yeah. Hey, Sharon, if you have a great group plan, cost and coverage, you don't have to do anything. In fact, the most elderly people I put in Medicare so far in my career was 79 and 83, husband and wife. They had what you have, A only, and put them in. Remember, it's that SCP process. Now, Sharon, just remember, and really anyone watching, if you keep working past 65, do not go without active employment insurance. Okay, so if you were to change jobs and there's a transition, COBRA doesn't count. So we have to have credible coverage every single month counted back to 65. So that's all you have to do is just keep working.
Okay, what income would make you have to pay for Part A?
Okay. Well, what makes you pay for Part A is when you don't have 40 quarters paid into the Medicare tax system. And so right now, what happens is if you're working, you're paying FICA taxes. And so they are deducting 1.45% from your paycheck. Your employer matches that. And that is going into the Medicare system. And so if you work for 1 full year, you just collected 4 quarters. And so once we've worked 10 years, we have 40 quarters. So anyone that has 40 quarters or more, 10 years worth of work, will never pay for Part A. So income does not have to do anything with paying for Part A. I hope I'm answering your question. Now, if someone doesn't have 40 quarters, then they can accumulate those quarters, and they don't have to work the full year to get 4 quarters. It's a dollar amount, and the dollar amount for 2024 is $1,730 for a quarter. So that would be times 4 would be what, $6,910, I guess. 1,730 times 4.
30, 69.20.
Okay, $6,920. So if you make in 2024 $6,920, you just got 4 quarters. If you make that in 1 month, you picked up the 4 quarters in, however long it takes to get to that dollar amount. So it's not a period of time. No more than 4 quarters in a year, but it's tied to that dollar amount.
Okay, I have a favor to ask of everyone that's watching this still. If you found this valuable, can you hit the little like button? There's a thumbs up button in YouTube. Thumbs up button. I'm being told it's a thumbs up button. hit that thumbs up button. And the reason for that is it lets YouTube know that you're enjoying this, and it pushes out to other people. Also, if you have not subscribed to the channel, it's free. Hit the subscribe button. We put out how many videos? 2 videos, 2 long videos a week talking about Medicare. And just teaching you guys everything that we need and everything that we know that you need to know and able to be able to get the most out of your Medicare benefits. So hit that thumbs up button. If you would, please hit the thumbs up and then subscribe. Also, if you need assistance with your Medicare coverage, we would love to help, right? So there's an 800 number that's scrolling along the bottom of the screen. We've got a team of people every day that come to the office that are passionate about helping people make sure they are on the right Medicare coverage for them. Our services are 100% free to you. So if you need assistance, call that 800 number that's scrolling along the bottom of the screen. We are booked out. It's starting to get pretty booked out. So if you think you're going to want our assistance this year, give us a call so we can get you in before that December 7th deadline.
Hey, there was a question there about that Part A deductible I saw on there. Did you see that one? He was just asking, it was up just a little ways. Yeah, there was. So
a person, that one? Mm-hmm. Okay, you want to hit that?
Yeah.
The dentist one?
Yeah, so can everyone already see that, or do I have to read that?
No, they can see it now.
Okay.
If a person is in the hospital for 1 week with Part A and B plus a supplement, then is discharged, readmitted within 24 hours, does Medicare see the readmission as one stay for deductibles?
Yeah, you would be considered under the same, it's called a benefit period. And so actually from the date you're discharged, from the next 60 days, you're still in the benefit period. So if you're rehospitalized, you would still be under the same deductible because you're in the same benefit period. But if I'm discharged and I go back in after 60 days of being discharged, then you would owe another deductible. Okay, so that's a good one.
Okay, my wife and I have our supplement plans with you. I also have a PDP and dental through you. My wife does not, but would like to change and have them through you also. How should she do that? Call the 800 number at the bottom of the screen, and we will be happy to assist you.
And Jose there, Josh, about his VA drug plan compared to the drug plans. Hey, the VA is wonderful. You're probably paying a copay of maybe $9 or so. The only time I ever suggest people that are veterans that should get a drug plan is if they may, just take a couple of real cheap meds, and then you get that plan right now. It's 50 cents a month, and you may have some tier 1 meds that are zero, where you're paying $9 a month for those through the VA. So sometimes it makes sense, but usually not.
Daniel, can you make that scrolling number a little bigger by any chance? Maybe not. Okay, we're going to answer those questions.
I'll be quiet.
We're going to go in order here. Okay, Doctor for coming surgery is against Advantage Plan, says they are admins and push hard to use only their hospital, and they have extra hoops to jump through and slow down the process. He says Medicare will pay better and let them do what is needed quicker than fight with the carrier.
And that's exactly right. Yeah, doctors, the majority of doctors are going to really be opposed to the pre-authorization process that's required on Advantage plans. That's what the doc's talking about. It has to be all pre-approved. And hey, we had a lady need a full hip replacement. They said, no, we'll only pay for a rod. Or you get denied things. And
or you got to go through, actually, our operations officer at our company, his insurance was telling him, like, hey, you can't, it was a pre-authorization thing. He couldn't, he had to go through 9 months of rehab. Mm-hmm. So he switched over to Medicare with a supplement plan, and instantly was able to get everything approved, right? Because there's just no hoops like that to jump through.
And that's the beautiful thing. It's your doctor and Medicare that make all the decisions when you're on a supplemental plan. The insurance company has no say-so. If Medicare pays, they have to follow. In fact, most of the companies put on their card, supplemental cards, no pre-authorization required. Where if you have an Advantage plan, about 70 to 72% of the services will have to be pre-approved by the insurance company, or they're not going to cover it. And you'd be responsible for it. And most people just walk away from that and just don't do it.
Okay, I signed up for A and B when I turned 65, but I'm still working and paying for employer coverage. Can I pause B, which they are charging for?
Yeah. Yes, and Steve, I would for sure. That's Form 1763.
Form 1763.
And Steve, I definitely would do that. Now, if you're going to retire in the next month or two, don't do that. But if you're going to keep working for a while, disenroll from Medicare Part B. It's the 1763. Now, on that form, they call it medical insurance. Remember, A is called hospital, B is called medical. So you're just going to be disenrolling from the B. Tell them the date you want to do that. If I were you, I'd get right on it. It's a real accessible form. Get it to your local Social Security office and they're going to ask you when you want to go effective. And I'd say November 30th. Put it on there and get that thing in. And then you'll pick up B at a later date, no problems. And then put a comment in there in the section while you're doing this. Just say, I made a mistake. I didn't realize I didn't have to have B. Now, Steve, also, we are talking about your employer having 20 employees on the payroll or more. Okay, so as long as that's the case, I would disenroll from B.
Arthur, can I get a supplement plan under contract 6 months before effective date of regular Medicare? Absolutely. In fact, I think there's 6 months is when most companies start accepting those. So we help people all the time that are, hey, I'm starting Medicare in 6 months. Perfect. Let's get you set up.
Yeah. And I think in that situation, don't they lock the rate in?
Yeah, carrier to carrier.
Oh, I did. Okay, yeah. Well, that's one of the benefits of doing it early.
Doing it early.
If the carrier will lock the rate in, that's nice.
Okay, if my wife enrolls for Social Security benefits next year, age 62, but will work to 66 or 67, how does she avoid automatic enrollment at Medicare at 65?
Okay. Well, she can't. Yeah. She will be automatically enrolled at 65, but if she wants to keep working, all you have to do is when the Medicare card shows up in the mail, you sign the back of it, mail it back in, and then they will drop off the B, which you have to pay for, so you drop off the B, and they'll send her a new card that says Medicare A only. So it's fine, Paul, if that happens. She will be automatically enrolled, but you can disenroll from B by mailing the card back in when you receive it. You sign it on the back, and they'll drop it off. No problem at all. And then she pick up B at a later date.
Okay. Why do you encourage enrolling in Part A while still employed with adequate insurance?
Okay, as long as you don't have an HSA, I would take A, and here's why. Because you're in the system, you've got a Medicare number that's not going to change now. Plus, it could be that Medicare could pay something. Remember, I said earlier, they're only going to pay co-insurance, but I've had people before where their group plan wouldn't pay for something, and yet Medicare would on the A side, and so that's another benefit. You're not hurting yourself by taking Part A as long as you don't have an HSA, so that's why I encourage it. And then when you retire and come into Medicare, it's real simple. We fill out the L564, the 40B, and you come into Medicare Part B. It's a seamless process, so that's why.
Okay, just turned 65 this week, retiring May 31st. Can I stay on HSA through end of May if I don't sign up for Part A now?
Okay, no, you can't, because you just turned 65. No, because they're going to backdate her.
Oh,
Yeah,
yeah.
they're going to backdate your A date. So turn 65 this week, so we have 11/1/2023 date. And she's going to retire in May, start her Medicare probably June. Yeah. Okay, so here's what's going to happen, Chris. And this can get a little confusing. But whenever you enroll into Medicare, they're going in your situation. They're going to backdate your A date. So if you're going to retire in May, I'm assuming you're going to start your Medicare in June. You're probably going to start enrolling around, let's just call it March or April. And so if you go in and enroll into Medicare March or April, they're going to backdate your A date to 11/1. They always backdate 6 months or the 65th birth month, whichever is first. They'll never backdate your A date prior to 65 unless you're on disability. So your A date is going to be 11/1. So the truth is, if you're contributing to an HSA, then your last contribution needs to be, well, it should have been last month. You don't want to put any new money in because you don't want to overfund it. Now, if you have funded it and you haven't put in the max, you're still going to be all right. Hopefully that makes sense. They backdate the A date.
So stop.
Yeah.
Right?
That's right.
That's the point.
Yeah.
Okay.
And you're fine. They could prorate. He's all right for 10 months of 2024, right? Which would be, but if he doesn't stop, if he overfunds it, then there's a penalty. Yeah, you usually have a penalty. I think it's about a 6% or 10% penalty if you overfund your HSA.
Okay, I'll be 65 next year and make over $80,000. Is it worth it to collect Social Security now? Oh,
I would say not. No. Yeah, because the most you can make at your age is $22,000 next year, $22,320. And so, which is what, not even $2,000 a month. You're making almost $7,000 a month. So your entire Social Security check is going to be taken away by the penalty. So I wouldn't do that. You don't need the money. Let that thing keep growing. Remember, it grows 6% a year. And then once you hit full retirement age, then it grows 8% a year.
Okay, do Medicare plans cover hearing aids?
No.
There are some Advantage plans,
Advantage plans
that will give you a benefit usually.
Yeah, that's right.
Yeah, they'll put money towards it.
Right.
Or give you a plan with a copay. But Medicare, as a general rule, does not cover hearing.
Yeah, not yet. They've been trying to pass that, but it hasn't passed yet.
Okay, I'm 64, work for a large company, and I carry insurance on myself and my husband. Husband works for, I guess, a less than 20 employee employer. He turns 65 in December. He wants to continue working since my insurance is so good, or should he sign up for anything? He can, if,
Yeah,
don't have to do anything.
yeah, as long as he's covered by his own, I mean, by your plan, because there's 20 or more. Yeah, he doesn't have to do a thing. Josh is right, totally. Yeah.
Okay, should I get a supplement or no supplement since I will have parts A, B, VA benefits, and TRICARE for life?
Okay. Well, here's the way it works. If you are going to keep your TRICARE, which I would for sure, TRICARE says you must enroll in A and B. You have to, because TRICARE only pays second to Medicare. So if you do A only, you're not going to get anything covered by TRICARE other than hospital. So don't do that. You're going to roll in A and B. And if you have VA, that's just an additional benefit that's available to you. But boy, you're just setting really, really well. I will tell you, Laddie, we have a lot of people in your situation that will still get an MA only plan. Medicare Advantage only. Drugs you can get through TRICARE, you can get through the VA, and then you get some of the perks offered by that Advantage plan plus the Part B reduction. You may get $100 a month towards that. So that's a good option, and I can see no reason why I'm not doing that. I just wouldn't get a supplemental plan if I were you. You would not need that.
Okay, next one. If my wife enrolls for Social Security benefits next year at age 62, but will work.
We just said that one. And we, oh, keep on.
Yeah, I think it's different, slightly different, but will work till 66. How does she avoid automatic enrollment? She contributes to the max to her HSA.
That's right. You just want to make sure that on her 65th birth month, from then forward, she's not contributing to her HSA.
Because there would be no way to suspend Part A at that
That's
point.
exactly right. She cannot. Now remember, you can max out up to that point in time. So next year it's going to be what did I say, $5,150. And so divide that by 12, and it's all prorated, so she can max out based on monthly. It's not, she can't put the whole year amount in, just per month she can max out.
Okay, if I enroll in Plan G and D through you to the insurance company, any change from now on, such as annual enrollment change, I should always go through with you. Absolutely. We have a team of people, we call them a coverage renewal team, and they are dedicated. It's a dedicated team that just helps all of our current clients make any changes that are necessary. Mm-hmm. Okay, they're licensed in all 50 states. Really good team. So if you need to make any changes, if you move, if it's during the annual election period, like what the period we're in right now, and you're a current client, give us a call. We'll walk you through.
Yeah, but let's clarify too. If all you're changing is your drug plan, we facilitate that. We have our own website where people go in there and look at all the drug plans. So supplemental plans, Medicare Advantage, team members are always going to touch that. But we give you the resource on the D plan if that's the only thing you're changing.
Which you can go to changemypdp.com.
Yeah.
Changemypdp.com. Okay, Kim Salze says, do you answer Social Security questions? Yes, we do. If you ask us a question and we're within the time, we'll get to it.
Yep.
Kay says, I have an Aetna supplement. When will I find out what my premium is for 2024? I enrolled in August of 2023, Part B and supplement. And the answer to that is Aetna doesn't take their premium increases on January the 1st as a general rule. It usually happens sometime between April and July of every year. That's how most of the carriers do it. So there's not a 2023 rate and then a 2024 rate. That's not how it works. It also could be tied to how old you are. It could be tied to the date of the policy. Maybe it doesn't happen until August. But here's the thing to remember. Anytime before there's a premium increase, you will get a notification from the carrier 30 to 60 days in advance, and they will tell you, hey, here's what your new rate is going to be. And if that rate seems unreasonable, that increase, give us a call. Our coverage renewal team that I was talking about a moment ago will help you shop around to see if there's a better price that's available. Okay. Does Medicare cover Ozempic for diabetes? The drug plans absolutely do cover Ozempic. Yes.
Mm-hmm. Now, let me clarify something. Not every drug plan is going to cover Ozempic, but there are plans that do, for sure.
Okay. My income will be low this year, so it's a good time for Roth conversions. I want to maximize the conversion but not trigger an IRMA in 2025. Can I assume modified adjusted gross income will adjust to 215 in 2025? What is it, 212 right now?
It's a 206 for a married couple.
Okay.
Yeah, 103 for a single,
Okay.
206
The number I was seeing for 2025, and it's all estimated, is 212. So I would probably try to keep it below that, but who knows what will happen. They adjust that based upon inflation. And it's really all driven off of what the,
Yeah,
Okay.
so I mean, hey, you're thinking well there.
Yes.
You are, and I'm assuming you're going to retire because you have a life-changing event, which then you can appeal.
Or if he stays underneath that number, then he doesn't even need
Yeah,
to
he
appeal.
did. You're right.
Yeah.
You're right.
Okay, if a person is hospital, wait, we just did this one. Hang on, please again go through the question about how to get dental and vision if I am not on my employer's terrible plan. So if you need dental or vision, there's standalone plans that are out there. We have a few that we recommend that are available throughout the country. So you can give us a call, and it will be a standalone. The dental plan is probably going to run you $30 to $45. A vision plan maybe $10 to $15 a month, and they're good plans. They'll cover a lot. Maybe a $2,500 to $5,000 benefit on the dental side, and the vision side they work a little bit differently, but good plans. So give us a call. We can help you do that. Can you repeat, if you start receiving Social Security, even if you are still full-time employed, you are automatically signed up for Part A? Yes, as long as you're 65 or older, right? If you start signing up for Social Security at 62, they're not going to, you're not going to get into Medicare Part A till you're 65.
Right. So at 65, what I'm saying, the card's going to show up in the mail automatically if you're receiving Social Security. Have to stay on A, don't have to stay on B if you have a group plan of 20 or more that you like. You can pick up B later.
My sister's wife is going to immigrate from China and will start work at a late age. Is there an age limit by which she has to earn her 40 quarters in order to qualify for no premium Part A? I guess it's 10 years, though.
Well, she's going to have 40 quarters, but her age, I mean, she can come in late.
Yeah, but if she came in at 60, could she get 40 quarters by 65? No. Yeah, so
impossible.
It would almost be like she'd have to start by 55.
Yeah, that's right.
Yeah, to get 40 quarters.
Yeah, and then I still think they penalize you back to 65. It's interesting. Yeah. Anyways, I've only seen it a time or two, but I hope we answered his question.
Well, she's got to get 40 quarters in, which is
she has to have 40 quarters.
10 years worth of work.
Yeah, but age doesn't really matter. But what I'm saying, I think I've seen someone that happened. They had their 40 quarters at age 70, but they still penalized them back at 65, even though they weren't even eligible.
So tell her to immigrate by 55 if she can.
Yeah, sooner the better.
Okay, will this be replayed later? Yes, it'll be live in our Facebook group and on the YouTube channel, so you can come back and watch it later. Can I wait until I get off my... I don't know this, so I'm going to skip this. I'm turning 65 in December. I'm resigning from my job, moving to Arizona, but I still want to work when I move there. I'm currently on California, but will it end when I move?
Okay.
Dennis, I don't know what the
moving to
question
Arizona,
is.
but I still want to work when I move there. Okay, well, if you are not positive, Dennis, that you are going to be working in January covered by a group plan, then you need to start your Medicare at 65. Because what I hear you saying is you're going to try to work and he's going to come in at an SEP, and we have to verify all the way back to December that you either were covered by an active employment provided plan or on Medicare. And so, Dennis, what I would do, I wouldn't take any chances. I would start my Medicare at 65, and if it takes you a month or two to get a job that has good insurance, then you can always disenroll from the Medicare Part B. You can't disenroll from A, but you can drop to Part B. Don't take chances, because I'm telling you, I have seen this several times in my career.
Yeah.
Person missing 1 month, and they were not eligible for an SEP. Okay?
You have to have it that
COBRA
month.
doesn't count once you're 65.
Active employment. Okay, here's the rest of this question. Can I wait until I get off my employer plan? I am on A but not B. I don't want to get Part B until I retire from work. The answer to that is yes, you don't have to get Part B until you retire, right?
That's right. That's right.
Okay, does the sub plan ever pick up the $226 deductible? My plan says it's paid. The doctor's office is billing me. If you're on a plan F, yeah, it's going to pay that supplemental plan. That's going to pay that deductible for Part B. But if you're on a plan G or an N, anything other than an F,
and the old C's and F's. Yeah, C didn't cover excess.
Okay.
Yeah, but it covered that. But that's it. I mean, there's hardly any of them out there.
Okay, my wife is coming off work insurance because she'll be 65 in January. We picked BCBS, which is Blue Cross Blue Shield, but we want to change to United Healthcare. Can we just go back and pick United Healthcare before December 7th? In fact, you don't. The December 7th has nothing to do with you. That deadline has nothing to do with you.
You're fine.
You can do it up to 12/31 to switch by 1/1.
Yeah, and what I would do in that situation, if you know you want UHC, I'd cancel now. She's not going to effect until 1/1/2024 anyways. Cancel the Blue Cross Blue Shield. If they drafted a premium, they'll refund it to you. And then call us. Say, we're one of their biggest brokers. We'll help you get that all set up.
Yeah.
Happy to do it. And you'll go effective 1/1/2024 on that plan.
Okay, these are maybe a little bit interesting. How about metabolic blood panels? Medicare doesn't pay unless it's medically necessary, so supplemental plan doesn't pay either, does it?
You're right, Karen. Supplemental plans follow Medicare. If Medicare pays, supplemental plan pays. If Medicare doesn't, they will not. Only exception is foreign travel. You get $50,000 of foreign travel emergency coverage on, I think it's 6 of the supplemental plans. $50,000, that's foreign travel only. Other than that, anything in the U.S., it's Medicare's, the supplemental plan follows Medicare. That's it.
What to do if medication is tier 4 because of prior surgery and claimed equal medication does not work right?
Okay. Well, you do what's called a formulary exception. Yeah. If there's something else that you want, just have call the number that's on your insurance card and ask them how you can ask for a formulary exception. Okay, and almost always you win that. And I think the rules are now they have to give you a decision like in 72 hours. It's pretty quick turnaround time. And if you have the doctor involved, that's probably the best. But anyways, fill out formulary exception paperwork and see if they'll add it to your formulary.
Okay, where can I learn about the differences between the various plans, GD, and etc.? You can watch our YouTube channel. There's a lot of videos on supplemental plans on our YouTube channel. Another thing you can do is you can go to MedicareSchool.com. MedicareSchool.com, it's right here behind me. And there is a link on there that says Get a Workshop. And you can watch the workshop that really covers everything that you need to know when it comes to Medicare when you're first starting. And Marvin will go through all the different supplemental plans in there. It's a great resource to learn not only about supplemental plans, but about Advantage plans, about drug plans, about how to enroll in Medicare A and B. That's a really good resource. So I would suggest that or the YouTube channel. You can also call our team, and they will walk you through that one-on-one. I'm thinking the G has taken over the F plan, which leads to the N plan, that when time comes there might be an O plan. Well, there might be an O plan. We've not heard of it yet, though. Let's see. No question today. I just got enrolled in Original Medicare and Plan G with the help of one of your awesome guides, Corey, and I just want to say thank you. You are a tremendous resource. Thank you. Thank you, Cindy. Corey's a great guy, too, so you got lucky with who you got to talk to. What is the best state to live in for Medicare?
I see no difference. Yeah, Medicare's a federal plan, so I don't think there's any difference. Now, I will tell you there are a few states that are higher premiums and those kind of things, but I think as far as coverage, it would be the same regardless of the state. The worst state to live in?
It's probably one of New England states like New York or something.
Yeah, I'd say pretty high premiums in New York, right?
Yeah. Okay, hubby passed in 2020, Vietnam vet. I am working part-time as of age 62. I am now 65. I took hubby's Social Security. When is the best time to take my Social Security, and will I get the full amount?
Yeah, what I would do, Kim, as long as your husband's Social Security is meeting your needs, I would wait until age 70 because then you've grown it to the max. So that's what I would do. As long as you know yours is going to exceed him, you can really do it at any point you want to, but at 70 you would have maxed it. It's not going to grow beyond that other than cost of living adjustments. So that'd be my advice.
Okay, should the official Medicare website list my enrollment in Plan G supplement? It lists my Part A, B, and D, but doesn't list my Medigap coverage. Should it?
Yeah, well, it will eventually because it's going to cross over. So if you've been on that G plan for a while, you don't see that. That's kind of awkward to me. What happens when you apply for a supplemental plan? they do notify Medicare that they're going to be in the second payer position, because when a claim is filed, Medicare pays first, takes the balance, sends it to the supplemental company. So Medicare knows that. So I'm not sure why it's not showing up yet. Maybe you haven't had a claim yet, or maybe you just haven't started. I'm not positive, but they do know that. I guess you're talking about your mymedicare.gov site.
Okay, this is a little tricky. I don't know if we have enough information. So the joint income's above the max. Okay, so he's going to have an IRMA, but income in 24 will not be that high. Starting Medicare June 1, 24, hard to appeal the income level for reduced premium. My guess is you're probably retiring in 24, which means you'll qualify for a life-changing event, which means you will qualify to be able to have that income looked at and appealed and be able to have that dropped off.
Yeah, and also, Chris, they're looking at 2022,
which is probably going to be high.
Yeah, 2024.
Point, yeah.
That's right. So once you get that you're going to get an IRMA letter, and that IRMA letter comes about 30 days, 60 days before you actually start your Medicare. So once you apply, you'll get a letter from them, and so if you have a life-changing event that has occurred, the work reduction or work stoppage, then you can appeal that income by that IRMA by giving them either your 23 income or your 2024 income. They always look back to the appeal process. We're eligible if we have a life-changing event, and we can ask them to look back one or give them present year or income projected.
Okay, does WEP GPO impact Medicare? I don't think so.
Windfall elimination provision, government pension offset impact Medicare. No, not at all.
That's used to reduce your Social Security benefits.
Yeah. So, nope, it will not. And that just means that's for people that have, those of you who's watching, this is for people that have had income that was not subject to Social Security taxes. Could be federal, could be some state income, different as teachers have this sometimes. And so their Social Security benefit is reduced if they have another pension that they're receiving that was not subject to Social Security taxes. That's called a windfall elimination provision, government pension offset. So windfalls for your own government pension offset is for spousal and survivor benefit. So the answer is no.
Okay.
Does not affect it.
Currently work for the VA, so he works for the VA. My 65th birthday will be October 24. Have Blue Cross and Blue Shield for myself, my spouse. When should I enroll into Medicare Plan A? Should I take a different or additional plan, A or B? Should I enroll in October 2024 or August 2024? I do plan on working for another 5 years.
Oh, wow.
A lot of questions.
Yeah.
If you're going to work for 5 more years,
yeah,
you probably don't have to do anything.
As long as you not contribute in HSA, which I assume you're probably not, take A only. And if you like your plan of work, don't do B until you're ready to retire. And then because you work for the VA, you'd have to find out if they require that you take Medicare B. Federal employees don't have to, though I think they should. So you got to ask a few more questions. Mm-hmm. Yeah. Sorry.
Okay, see if you know this one. I'm covered by retired husband's federal Blue Cross Blue Shield standard. He turned 65 and is on AB and Fed BCBS. I turned 65 in February. Should I do the same? Great insurance, but Part B with Fed is expensive.
Okay, yeah, I would take B if it were me. And what's going to happen is Fed Blue is going to give you an $800 credit if you do enroll in A and B. So that's nice. And then what we have a lot of people in your situation who have FEHB benefits is they keep FEHB and they take a Medicare Advantage only plan, like a veteran could do. And that way you get reduced another credit on your Part B, and then you use some of the perks that come with the Advantage plan. So we have a lot of federal employees are doing that. You don't have to, but regardless, I'd still enroll in A and B. And as I said, you'll get that credit back from Blue Cross.
Okay, does original Medicare cover if you are overseas and need emergency care?
Yes, it does. It covers, well, let me back up. No, supplemental plans will do that, but original Medicare will not cover you outside the U.S. or the U.S. territories. So you have nothing. Yeah. Not at all. So your supplemental plan, FGN does, a couple other letters would give you $50,000. So what I would do, Barb, is I would definitely get travel health insurance. They're usually very affordable, and don't take chances. Hey, we've had cases. Someone air evacuation. Most recent one was about $280,000 a plane ride from Costa Rica to San Diego. So get travel health insurance, and read the fine print on them too.
Okay, your team just assisted me in my initial Medicare enrollment. Your team is very helpful and knowledgeable. Thank you. Thank you. James Scroggins. Sydney says New York is good for not allowing excess charges from doctors. That's true. That is why we, in the state of New York, we always recommend a plan in. Supplement plan in. We don't recommend plan Gs in the state of New York. They're just too expensive. It makes sense to get a plan in. Are plan G and N coverage the same in all states? Asking because we'll be moving to another state late in 2024. The answer to that is yes. Wisconsin and Minnesota call them something a little bit different, and Massachusetts as well. But the benefits really stay the same. Yeah. They have equivalent ones. But if you're on an N plan in the state of California and move to Nevada, it's going to be the same plan. They will probably adjust your premium to be what is normal and customary for your age and with that carrier in that state. That's right. Which means it could go up or it could go down. Yeah. Let's see. I've been a client for 2 years on. You guys rock. Thank you, Roberta. We appreciate you. I'm FEHB retired. We'll start Part A and B with FEHB in May next year. Is it true that FEHP and TRICARE retirees that have A and B also enroll in Part C, MA only free plan with a monthly rebate? Yes. Yes. If you have FEHB, the one thing we really encourage you to be careful of is enrolling in a supplement plan, because if you enroll in a supplement, you cancel that right to ever go back to the FEHB benefits. Yeah. But if you get an Advantage plan, that is not the case. You simply suspend your benefits, and then every year you can have the decision to go back. Or
what I would do, I would fill out a form. If I were in your situation, I would suspend my FEHB benefits and use your TRICARE, because you're going to have to pay for FEHB. There's a premium for that. And so there's a form, I don't remember the name of it, but it's an OPM form, and they give you different options. And what Josh was saying is true. You do have the option to suspend and just take a normal Medicare Advantage plan, or you can suspend your FEHB and just use your TRICARE with an MA-only plan. So I wouldn't have all that. To me, TRICARE is awesome. And you get an MA-only plan with that, that's even great. And the good news is, if you don't like the decision, it's not permanent. You can always go back in and just have FEHB by itself or TRICARE by itself. You have options. But what you don't want to do, and this is what Josh was cautioning, if you get a supplemental plan on that form, you actually have to terminate FEHB, and that's permanent. And we don't like that option.
Okay, I'm currently enrolled in an employer plan, turning 65 in April. It's a high deductible with HSA, planning to retire in September. Do I have to change my health plan to one without an HSA, and when?
So you see, I'm turning about April? Okay. What I would do if I were you to play it safe is this. Continue to contribute to your HSA through the month of March. So you get 3 months, and so next year it's $5,000. So you can put in about $1,200 in your HSA up to that point in time, and then stop contributions. Because if you retire in September, they're going to backdate that A date to April 1, and you're no longer eligible to put new money in. But again, max it out. You're fine to do so.
Okay, I will be 65 in January 24. Info provided by Georgia SHBP, automatic enrolled to Advantage plan at age 67 when I retire. No plan that the GA SHBP will subsidize. Already have Part A. Recommendation.
Yeah. Well, what I would do, I would look at the details of that Advantage plan that you're being forced into, see if you like it. Those are called waiver plans, and they're different than just normal market Advantage plans. But here's the issue. You still have pre-authorizations, you still have networks, and the biggest issue is if you want to get off that plan, now you got to medically qualify if you've been on that plan more than a year. And so, again, it still comes with the negatives, and which is really sad. All these companies are just forcing people in these Advantage plans. And if you're happy with that, then go for it, okay? But there's still some problems, some disadvantages to the Advantage plan.
Okay, I just made 65, still on employer group medical for $25 a month. Been a widow since 94, advised to wait till 71 to make max of $4,100 just on his benefits. Do you agree?
Yeah, well, max 71 is not accurate. The max is 70. No one can grow the account to beyond age 70. So you're just off a year there. And so, yeah, I think it's great to wait. If you don't have to have the money, then I would definitely let that go, for sure.
Okay, Paul, your question is, will the IRMA exception be approved before we are charged the IRMA premium?
You will have the time to appeal it before they assess that. So the letter says, once you get to the IRMA letter, it's going to say they want you to reply within 10 days of the receipt. That gives them time to consider your appeal to see if they grant it or not, and that way they can drop off those IRMAs. So just move quickly.
Okay, and guys, we're just about done here. Husband and myself on Plan G. I was told I had to stay with Aetna for 2 years. Is this correct? I don't know why that would be the case.
Yeah, boy, I don't know that either. I mean, you never heard of having to be on. Now, what could have happened, if you had some kind of a health issue in the last couple of years or something, you may not have been medically qualified to get off. But you're not forced to stay on a supplemental plan for any particular period of time.
Is Medicare Advantage only available in Alaska? No, there's supplement plans up there. Yeah.
In fact, I don't think there are Medicare Advantage plans in Alaska
I
at
don't
all.
think there is either.
Yeah, they have a difficulty with networks and all that. They can't make money up there. Not enough. Last I checked, there were no Advantage plans in Alaska. I could be wrong, but let me know.
Who edits your online videos? That person is a talented individual. His name is Daniel, and he's sitting about 10 feet that, and he's amazing.
Yeah, we agree with that, David.
If either of us die, he's going to start giving the Medicare content because he knows it all better than us.
But you can't hire him, okay?
My employer's okay. This is the last question. My employer's insurance offerings are too expensive based on my age. I'm 63. When I'm 65, would I be required to enroll in my employer's option instead of Medicare supplement?
Absolutely not. You can take Medicare at 65. And sounds like you need to do that. So 3 months before you turn 65, start enrolling in Medicare, pick out your plans, and drop that group plan.
Okay, guys, we want to wish you a happy Thanksgiving. Hopefully it's a wonderful time with your families. If you need help with Medicare, that phone number is at the bottom of the screen, 800-864-8890, 800-864-8890. You can go to our website, medicareschool.com. You can watch our workshops, or you can click to schedule an appointment with one of our agents. We would love to help you. So we look forward to talking to you. We look forward to seeing and hearing your questions. We'll do another one of these in the future. Thanks.
All right. Thank you.